Hi, I want to talk to you about estrogen, the good, the bad, and the ugly. So, this is a huge topic in women's health across the board, has been for years. But there's a lot of information that women don't have, and that's what I want to talk about today. This might be a problem for you. Estrogen is known for a lot of problems. It gets a bad rap for a reason. It's associated with heavy periods, painful periods, endometriosis, ovarian cysts, and PCOS, breast cancer, fibrocystic breasts, migraines, even gallstones. So, this is why we need to talk about high estrogen. It is important. We need it. Estrogen is good, and too little can cause problems too, which is another talk. But if you're not processing it correctly, or if you have too much in your body, it can cause all of these problems. So I want to talk about some patients. So some patient examples that I actually have. Now this is just a stock video, not the actual patient, obviously, and not her real name. But these are real people that I see as patients. And I want to show you this so that you can see all the different types of situations that can happen. And maybe it applies to you or a friend of yours, a mom, a sister. And so you can take into consideration what you or she needs to do and that this actually could be a problem for her. So Bonnie, so we're going to call her, is a 47-year-old woman. She has had a Mirena IUD in, and it's on its 4th year, so it's been in there for a while. It's due to come out the next year or two. She started to track her cycles and noticed that she has sporadic length of her cycle. Now she's having 45 days between her cycles. Now this irregular periods are common on the Mirena. However, this is what clued her in to ask for hormonal testing. On October, she changed her diet of last year and lost 50 pounds. This is important because losing a ton of weight in a short amount of period of time can release a lot of estrogen into your body. Estrogen can be stored in your fat cells, and so quick and rapid weight loss can cause not only high estrogen levels, it can also cause toxins to be released in your body. She is also having severe leg cramps and occasionally has really significant fluctuations between hot and cold at night. I did a test on her for her serum labs, and her total estrogen was 788. This is very high. You can't see the reference ranges on here, but you should never have your total estrogen this high at any time in your cycle. And the other significant thing is her progesterone is less than 0.5, so they can't even measure it. So not only does she have high estrogen, she also has extremely low progesterone. Now, progesterone is very important because it balances the effect of estrogen in our body. And if you have high estrogen, that's bad enough. If you have low progesterone, it exponentiates it. On review of her previous records, I saw that she had an ultrasound that actually showed adenomyosis, which is a more significant form of endometriosis, where your endometrial cells actually grow into the muscle of your uterus. She had an enlarged uterus, a complex ovarian cyst, and a small uterine fibroid. She knew nothing about this. The doctor did not inform her. Unfortunately, this happens a lot, which is why I always request records of previous labs and ultrasounds and imaging. So I did a repeat ultrasound, and again, it showed adenomyosis. The previous one was 4 years ago, so we needed to repeat it. And she had now multiple ovarian cysts. So this is a problem, and if this had been caught 4 years ago, possibly this could have been changed by decreasing her estrogen, which is what caused and contributed to the adenomyosis and large uterus ovarian cysts in the first place, and we could have treated it. The doctor just gave her Mirena ultrasound, which corrected the heavy bleeding that she was having and probably would still be having, but it did not correct the cause. All right, next patient. This is Fanny. Fanny is a 55-year-old woman. 5 years ago, before she saw me the first time, she was having irregular periods, heavier bleeding, longer periods, up to 3 weeks and more at a time. She was having clots from pea size to tablespoon size. If there's any men listening to this, I know it's TMI. You can just shut it off. This is not for you. It's for the women. She was having increase in migraines before every single period, vaginal dryness, which caused pain after sex. She's also having urinary urgency and frequency, and an increased sensitivity to smells and odors. This is important and significant because This usually indicates that there's something going on with your liver. It's not processing and eliminating things, so it's making you more sensitive. And the liver is important to eliminate your estrogen, so it's also could be contributing to telling us why she is having a problem with her estrogen. I did her hormones, and her estrogens are actually low on labs. Now, this is why we need to see this, because someone could do this test and say, oh, her estrogen is too low. We're going to give her estrogen. Now, that would be the worst thing that you could possibly do for her if you don't actually help her process it, metabolize it, and eliminate it. Her total estrogen is fine, but her estradiol is very low. This is why it's important to measure both your total estrogens and your estradiol at least. We also see, I did another test on her called a Dutch test. This is by far my favorite test for women. It's called the Dried Urine Test of Comprehensive Hormones. Not to confuse with anything with Dutch or Pennsylvania or anything like that. On this test, it actually tests your urinary metabolites, which is a different marker than blood. So I now in my practice am always trying to do both blood and a Dutch test or something else. Her estrogen and her progesterone are both in the postmenopausal range, but this test looks at her estrogen metabolites. So you can see here, even though her estrogens are all low, you have 3 estrogens, estrone, estradiol, and estriol. They all have different functions and uses in the body. But the way she's processing them, I'll show you on the next slide, you can see closer. So this is the good, 2OH is called the good, 4OH is the bad, and 16OH is the bad, and 4OH is the ugly. 4OH is the way that you process your estrogens that is associated with those dangerous things that were all on the second slide. Breast cancers and colon cancers and all those awful things. So she has lots of 2OH, however, she has too much 16OH. The reference range is 7.5 to 11% of her total estrogens, and hers is 13.2, so way too much right here. And this is what was causing her heavy bleeding, even though her estrogen is actually low. Now, I did a pelvic ultrasound, and she indeed has 4 fibroids, thickened endometrium, which is a big problem, and a cyst on her ovary. We ended up having to send her for a biopsy to make sure that it was not anything more than a thick endometrium. All right, next patient we're going to call JJ. This is a 35-year-old woman with cyclic migraines the day before every single period. This is a very classic estrogen problem. 2-day periods, so they're short, however, they're very heavy. She ends up having to change a super plus tampon every 2 hours the first 2 days. She also has clots from nickel to quarter size. Her Dutch test, we didn't do blood tests for her, but her Dutch test was exorbitantly high in all 3 types of her estrogens. This is the highest levels on a Dutch test that I've ever seen. Now, thankfully for her, she has amazing estrogen metabolism, which is probably why she wasn't having all these other problems outside of her period, but still too much estrogen. And also, thankfully to her, her progesterone is also very high. So she's balancing her estrogens remotely well, but still, this is at the upper limit, and this is way beyond the upper limit. So when you have really high estrogen, it has to go down on your period. And when it's that high, it often can drop extremely fast. That rapid and fast drop can trigger those things like migraines, and if your threshold is low. So there's a lot of things that can lower and increase your threshold of migraines, like mold and food allergies and all these different things. But estrogen dropping can be the trigger. She also had a little bit lower of methylation, but not too bad. So I'll get into that later. Eliza, another patient. She is a 29-year-old young woman. She had a history of irregular periods. She went on birth control because of her irregular periods, and she was on them for 4 years. She stopped the birth control to try to conceive, but again, her periods were very irregular, 30 to 50 days between cycles, and no real evidence of ovulation. She's been trying to conceive for 10 months at the time of this other test that I did called a Rhythm Plus test. First, I did blood labs, which showed that her estradiol was low, but again, you can't really know when to do an estrogen blood lab if someone has extremely irregular periods, which is why, again, very important for your provider to know what test to do. Because someone could see, oh, you have low estrogen, that's why you're having trouble conceiving. Let's put you on estrogen. Not usually a treatment for infertility, but basically this is a false positive, a low estrogen. So we did for her this awesome test called a Genova Rhythm Plus by Genova Diagnostics. Because of her regular periods, this is extremely helpful to see exactly what's happening in her cycle. So this test, you actually do a salivary sample every other day, the entire cycle from one period to the next. And you can see that she might have some normal levels of estrogen up here, but in the beginning of her cycle and in the end of her cycle, her estrogen is way too high. Not only is her estrogen high, but her progesterone, what is it doing down here? It's so low. It should be going up, and it actually is like dipping down here. It should be doing this nice rise. So she's both estrogen dominant and progesterone deficient, which again contributes to both her symptoms and her difficulty conceiving without regular ovulation. So a problem for her. Last patient, Vivian. She is 31 years old. She came in for something completely unrelated to hormones. She had actually gone to the ER for a sudden onset of weakness, full body feeling cold, dizziness, odd neurologic symptoms. She went to the ER and they just thought she was having a migraine. So then she came back to see us. She's having increased loss of hair in the recent period of time, handfuls of hair. She also reported to me in my detailed assessment of her history and her review of symptoms, which I always do, even if they come in for a specific problem, always do a complete review of symptoms because you can find other things. Her period was late by 1 day. Now, this had only ever happened twice before in her life. She's one of those fortunate women that has an extremely regular period, so this was significant to her. Her pregnancy test was negative, but in her typical pattern, she spots for a week, then she stops. She spots for a week, but this time she didn't have any spotting at all. She also happens to have a lump in her right breast that she's had for a year. She has a family history of cervical, uterine, and ovarian cancer. So what does that tell you? She has a genetic component to estrogen problems and cancer. She has a history of migraine and cluster headaches. She has frequent low blood pressure, dizziness when she stands up, and another interesting fact, she has mold in their windows. Yes, she cleans it regularly, but when she traveled out of state, she had 0 migraines. So another possible thing that can be contributing to why she's not getting rid of her excess estrogen. Her estrogen is 1055.2. That is exorbitantly high. And again, nobody would have tested for this if I hadn't asked her about her period. Her estradiol is basically within the normal range. It's not flagged. So if someone had simply done her estradiol and not her total estrogen, they would have said, oh, it's normal. They didn't even mention it to her. You can see down here, she's got some other stuff going on. Her zinc is really high, and she has candida. Surprise, surprise, with the mold in her windows. So I tell you this because there's other things that can contribute to the cause of high estrogen. And that's why you need to have an extensive, detailed history, review of symptoms, and a provider who really knows what they're doing and has experience with this. So addressing her estrogen is going to also include treating her house for mold and treating her body. So all this to say, you need to have a Goldilocks principle with estrogen. You don't want too much. You don't want too little. Too little, not enough estrogen actually can have a ton of symptoms. And this is, all the things that classically go along with menopause. But as you saw in one of our last examples, you can have low estrogen. You can be postmenopausal and still be not processing your estrogen in a healthy way and have risk for things like breast cancers and ovarian cysts and things like that. So what do we do with this? What do? We test and don't guess. This is a mantra in functional medicine, test, don't guess. Because you could say, oh, I probably have high estrogen. But do we know if it's all high, just the estradiol is high, total estrogen is high, but your estradiol, estrone, and estradiol are fine, which can mean that you're actually being exposed to xenoestrogens. Are you normal, but you're not eliminating them? Test, don't guess. And these are the test options that I most commonly recommend. There is lots more. The most standard types of testing are those that you would get at a lab or hospital. Quest and LabCar are the most common labs. These are great for overall free level, broad ranges. You can, if they're free or cheap if you have insurance. So if that's all you can do, then it's great to be able to say, is it exorbitantly high or completely unmeasurable? You can at least see that. However, it must be timed. If you're a premenopausal woman who's having cycles, then you need to actually have that timed 5 to 9 days before your period is due, ideally 7. That's the time when your estrogen and progesterone should be at their peak, and you want to see what that ratio is. So if your doctor didn't time it or your provider didn't time it, then it's not an accurate test. The one that I showed you that does the metabolites is called the Dutch Dried Urine Test of Comprehensive Hormones. Amazing test. It shows you how you're processing and eliminating estrogens. It's the only test that I know of that shows the 2-OH, 4-OH, and 16-OH. It's only $250. It tests for way more than what I showed you. It tests for your B vitamins, melatonin, cortisol throughout the day, which is extremely important. The best test. Saliva testing is also available, and this is how you can test throughout your entire cycle. So great for women who are perimenopause, or have irregular cycles like PCOS, cycles like every 2 to 3 months, never can tell when they're happening, or if you had your uterus taken out but you still have your ovaries. So your body is still cycling, but you don't have a period to tell you when day 1 is. Insurance does not usually cover these, so that's the downside. But you can, get a really good idea of what's going on with this. Also great for infertility because you can see what's happening around ovulation. So what causes high estrogen? Well, there's 3 different ways that your body eliminates estrogen. It can be you're producing too much, but most commonly you're not eliminating enough. There's 3 phases of estrogen detoxification. Phase 1 is that 2, 4, and 16-OH that I showed you on the Dutch test. The ways that you can help support this. Now, I'm not going to give you specific supplements and dosages in here. I mean, vitamin E and magnesium, those are pretty harmless, but I'm not going to give you specific treatment protocols for a very important reason, because you need to test. I know you, because I do the same thing. I'll watch a free webinar and I'll say, oh, I must have high estrogen. I'm going to go buy this supplement and take it. But you need to test. So these are some things that are really harmless that you can do if you, want to get started, or if you've already been told you have high estrogen, you've already been tested, and they're not going to hurt you if you don't have high estrogen. So broccoli sprouts and cruciferous vegetables are really great at helping your body shunt towards the healthy 2-OH. Raw carrots are surprisingly really well. Vitamin C, E, and magnesium. But there's more. Phase 2 is methylation. This is involved with your genetic SNPs called MTHFR and COMT. You have to know that via genetic testing, which you can get with like 23andMe. You can actually get on Quest and LabCar as well. The ways to help improve this, if you do have these, or you've been shown to have poor methylation on a Dutch test or other testing, is to improve your gut health. That's a whole nother topic. Replenish some nutrient deficiencies that you know are low. Now, be careful because you can take too much B12 and you can take the wrong types of folate. So again, do this with the provider's guidance, please. Phase 3 is elimination. And really, you have to start with this. So if this is a problem, don't go, taking a bunch of the other supplements without making sure that you first are eliminating correctly. If you're having a bowel movement every 5 days, every 3 days, that is not okay. If it's hard, if it stinks, that is not okay. You need to improve the elimination first before you improve your methylation and 2-H metabolism. But the ways you can do this are support your bile production from your gallbladder. Again, we said high estrogen is associated with bile problems, so they commonly go together. Drink tons of water. Prebiotic foods, they're all listed there. Probiotic foods, take a high quality probiotic. Buying a cheap $8 one off the shelf is really not sufficient. And stool testing to evaluate if you have beta-glucuronidase is really high. That's one way that you eliminate estrogens, and everything. Evaluate everything, because you can have a imbalanced dysbiosis. You can have a parasite. I'm treating 2 women for parasites right now. So there's a lot that goes on with this. So all of this to say, if you want some more information, there is a group visit coming up that I am teaching on November 11th, Thursday at 4 p.m. It's online, so you don't have to leave your nice cozy house. And group visits are awesome. They're really fun because women can chit chat back and forth. We can talk about what we're experiencing. You can feel like you're not alone. You can have a chance to listen to other women's symptoms and identify with them. You can ask questions, listen to what they're asking that you didn't think about, but you would have 3 days later. You can gather from their experiences, and you actually have better satisfaction, the research has shown. So this is a medical group visit, and if you want to schedule for it, please call my office. The number is listed here, and I would love to have you. All right?